Okay, so for repro, it's all about fertility management. So the natural methods such as withdrawal is highly ineffective and honestly should never be done. Um, you're gonna have a couple methods. So condoms, diaphragm, spermicide, IUD. Condoms are a physical barrier. Diaphragm is also a physical barrier. However, it's inserted closest into the vagina, sorry. Spermicide is kind of just killing the sperm on site. And then an IUD can be either hormonal or copper, and it's just preventing sperm motility and implantation. So in terms of condoms, just try to give advantage and disadvantage for each one. You get STI protection. Disadvantage is that it can interrupt sex. It's also single use. The diaphragm is going to prevent sperm in the female uterus. However, disadvantage is that it does require fitting and often a prescription. Spermicide, yes, it does provide some STI protection. However, it is unpleasant for some. And the IUD is effective for many years. However, requires prescription plus fitting. Often using multiple methods such as condoms and spermicide or an IUD and condoms can be a very effective way. Remember, failure rates are very low. Now, I will like to say though that obviously having surgery is the most effective way, and then often it's going to be hormonal barrier and then natural methods which should be avoided, but that's usually the trend in terms of efficacy of preventing pregnancy. And obviously surgical methods do have their other disadvantages. For example, if let's say a couple wants to become pregnant after having certain surgical operations, it can be very tough to do so. So those things also do need to be considered. Now, there was something called a sperm analysis equation, and yes, you do need to know it. All it's saying is that the concentration is dependent on these three factors. So you have the mean average number of sperm, you have a square multiplication factor, and then a dilution factor. The reason why we have this one is because of the way the experiment was conducted, and the square multiplication factor is to accommodate for scaling, because there were essentially lots of sperm in many squares, and hence, because we're only looking at one square for the mean number of sperm in that one square, while we do want to know for many squares, that's why we're multiplying against this multiplication factor. Memorize this equation, do a couple practice questions. I think they were in the GLS. Now, you have these three terms: oligospermia, normozoospermia, and azoospermia. Oligozoospermia is just less than 15 million sperm. Normozoospermia is more than 15 million sperm, or the total sperm count is more, I guess, around 39 million or more than that. And then azoospermia is nothing. Essentially, in terms of our assisted reproductive technologies, we have two different big categories. So one is on the male factors and two is on the female factors. So artificial insemination, essentially what it's going to do is it's going to introduce spermatozoa into the female tract. And so maybe we extract it from the male and we insert it via catheter or synchronized we synchronize it with the natural or induced FSH and LH ovulation. So let's say we have limited motility problems. That's when we would use artificial insemination. Now, in terms of IVF, notice these key steps. One, we're retrieving the oocyte. We still have natural penetration. The embryo then becomes cultured though outside, and it's just later reinserted. So let's say we have very poor sperm motility. That's why we're retrieving the oocyte, because the sperm can't even make it via the tubes and meet with the oocyte. So that's the purpose of that. And then we have ICS1, which is basically you have immotile sperm. And what's going to end up happening is that the sperm is directly injected into the oocyte, and then it's activated via calcium to develop, and then maybe it's later reinserted, however that way may be. Now, in terms of our female factors, we have GIFT, ZIFT, and IVF. Again, the IVF here is the same. However, because the female factors have to do with blocking of the tubes versus the male factors have to do with motility, in the female factors version of IVF, essentially you're removing the oocyte, natural penetration, embryo cultured, and then reinserted. And then here, essentially, I think there is the option for how that reinsertion is done, and that's kind of where gift and zift come in. So for gift, essentially the oocyte is transferred to the oviduct. Essentially, it's just transferred into the duct. Nothing else is being done there. So in gift, usually there is no problem with motility of the sperm. Versus for zift, we have some poor sperm motility and we also have a tubal block. So again, this is going to be like IVF. Notice IVF was oocyte retrieved, natural penetration, embryo cultured, and then reinserted for natural implantation. However, instead of, let's say, implanting it into the uterus, essentially for zift, we're putting it back into the oviduct. And there are many reasons as to why a medical practitioner may choose one over the other. They all have their advantages, pros and cons, and this is a new area of research that we're still understanding. The main thing for this is differentiating the male factors versus female factors and learning all 6 of these. IVF is very important here because it's come up multiple times, and then maybe gift versus zift.